Hi, I'm Dr. Chris Cox with Life Align Wellness Center. If your very first steps in the morning feel sharp, stiff, or like you're stepping on broken glass, yeah, that's brutal. That first step pain is often the classic signs of plantar fasciitis. But here's the most important part that people don't realize. Your heel is usually just where the problem shows up, not where it actually starts. So today, I want to actually take the 25 years of doing this and explain in plain English why this keeps happening and what actually helps. What actually is plantar fasciitis? Well, the plantar fascia is a thick band of tissue that runs along the bottom of your foot. So you can kind of think of it like a secondary support cable for your arch. It helps absorb and release energy when you walk. However, here's the big misunderstanding. It's not your foot's main support system. Your small foot muscles and ligaments are supposed to do that job. They're called intrinsic muscles. When those get weak, overworked, or just stop doing their job from age, footwear, or uneven stress, the plantar fascia gets stuck doing way more than designed to do. And simply over time, that extra stress damages the tissue, and that's when plantar fasciitis shows up. That's also why people often see heel spurs on x-rays. Those are usually long-term responses to chronic tension on this plantar fascia, not the actual real cause of your pain. Why does it linger and just kind of keep going on? Well, plantar fasciitis almost never starts from one bad step. It's more like death by 1,000 small stresses, right? Big jumps and steps, longer work shifts, or a new routine at the gym can overload already irritated tissues. If your ankles are stiff or your calves are tight, more stress ends up in your heel. If your foot and calf muscles are weak, your tissues can't simply handle the daily demands of the stress you're putting on them. Shoes that don't match your foot or your job can make absolutely everything worse. And a lot of the time, issues higher up the chain, like your hips, pelvis, or spine, change how force travels down into your foot. One big, long biomechanical dysfunction. If you don't fix those things, the heel pain just keeps cycling on and off. Well, how do we actually assess the heel pain? At Life Aligned, we don't guess, we test. We actually look at how your body is moving. We start with a conversation so we understand your story, what hurts, when it hurts, and what you've already tried and what you're looking to get back to and do again. Then we check your foot, ankle, and calf mechanics. We look at how you walk, how you balance, and how your foot strikes the ground or foot strike. We use three-dimensional AI-powered movement analysis so we can literally see exactly how your body moves in real time, really highly detailed. We use our what's called subluxation station to assess your nervous system, basically checking whether your brain and body are coordinating movement in the ideal way. All of this helps us find the real root of your problem, how long this has likely been kind of brewing in your body, and give you a realistic idea of how long recovery might actually take. So how do we actually care for this? Well, recovery follows what we call a phased plan, but we always personalize it specifically to you. Phase 1 is called calm the irritation. It takes about 2 weeks. The goal is to take the pressure off the irritated tissue and actually let the healing begin. We often start shockwave therapy pretty early to help break up scar tissue and chronic adhesions, and rehab usually starts shortly after that, really based on what you can tolerate. And if needed, chiropractic care begins right away to fix the deeper biomechanical and nervous system issues that may be at the root of the problem. Well, phase 2 is actually called restore motion. That takes about 2 to 4 weeks. We work on getting your foot, ankle, and calf moving properly again. And then we move into phase 3. This is called rebuild capacity. Takes about 1 to 2 months. We gradually load the calf and plantar fascia, strengthen your small foot muscles, and slowly increase your activity. And then we finally move into phase 4, which is return and prevent. Takes about 8 weeks or so, where we really help you get back to work, walking, and exercise, and teach you how to avoid this problem from starting all over again. And just to be clear, we do not rush into orthotics. We want to make sure your body is balanced and moving as close to normal as possible first. Simply put, we don't want to prop up or support an imbalanced state. When do we use shockwave in orthotics? Well, shockwave is really helpful when there's stubborn irritation, scar tissue, or adhesions that the plantar fascia that just won't settle down. This is often occurs in chronic conditions. We use it to create a better environment for healing and always paired with rehab. Now, orthotics are actually not automatic. We usually assess around 8 weeks, only after your movement has improved, it's become less painful and sensitive, and because, simply put, we don't want to lock in bad biomechanics that often occur with a painful foot. When used at the right time, these tools can be very helpful, but the key is they're never the main fix. I want to take just a moment and talk about kind of a recent case that I worked with, a person who had heel pain for well over a year. Now, this person had tried stretching and inserts and rest and pretty much everything under the sun, and nothing really stuck. Our exam showed stiff ankles, weak foot muscles, and a gait pattern that was being driven by pelvic imbalance. We started with early shockwave, corrective chiropractic care, and targeted rehab. Over about 8 weeks, the pain steadily improved, their movement normalized, and they could walk and stand again without all these flare-ups. In the end, they didn't need orthotics, because their body started working properly again first. Now, you've got all this great information. What do you do with it, right? Well, if you're dealing with heel pain and plantar fasciitis in Tucson, and you really want answers, not just quick fixes, but actually get to the root of the problem, we'd love to help. Book a consult with our team or download our free plantar fasciitis guide to learn more about our approach. You don't have to live with this. You don't have to figure it out on your own. That's what I'm here for, to use 30+ years of experience in dealing with this and getting people to get back to doing the things that they love to do pain-free. We've got you.